So, the UK government and the Conservative Party are trying to give Brexit credit for our fast approval of a German vaccine under EU law. Let me say that again. Our government, starting with Matt Hancock, have been trying to give credit to Brexit for our approval of a vaccine developed by a German company with Turkish co-founders in partnership with Pfizer, an American company with, incidentally, a Greek CEO, vaccines being packaged for us now in Belgium, and we have allowed ourselves to fast track this under provisions in European law when we are still under the frameworks and structures of European law until January 2021. Let's go into this a bit more, shall we, so that you understand. Matt Hancock has been claiming, and this has been echoed by Jacob Rees-Mogg on Twitter, Nadine Dorries, Michael Fabricant, and a lot of other Tory MPs, that because we've now left the EU and their medicines approval agency, the European Medicines Agency, and we're going with our own medicines regulator, the MHRA, that's why we're first in the world to get out of the traps, because thanks to Brexit, we're using our own regulator, which can be faster. This is false, because the situation is we are still fully under European law for medicines. We may have officially, in name only, left the EU in January 2020, but for all of the legal structures as relates to medicines and goods and products and free movement and what have you, we are still in the EU structures. So that law still applies to us. And it is a law 2 decades old that can be found in the Medicines Directive of 2001. And there's a great thread on this by George Perrett, QC, who knows this inside out, that we are allowed to use products, drugs that are as yet unlicensed by the European Medicines Agency. We're allowed to use them, approve them nationally for use, if there is an urgent need for it, such as you've got an infectious disease which is spreading rapidly. So it's that provision from 2 decades old that has allowed us to do rapid approval on an unlicensed product at a national level and start rolling that out. Now, it needed some domestic smoothing. So then in October, there was an MHRA consultation about how you would actually use this when a vaccine comes along. And so then there were changes made to UK domestic law in order to smooth that pathway of actually getting out an unlicensed vaccine throughout the country. So that's what that was in November. And those like Nadine Dorries, who are tweeting saying, we've been able to make changes to the law to get around all of the EU regulations, is false. This all happens within the framework of EU regulations. We just had to tidy up the domestic path. That's what that was. So the summary is that everything that we've done now, we would have done exactly the same way if we were still full members of the EU. We would still be under that same law. We would still have that same opportunity through that provisions in the 2001 Medicines Directive, and we would have still had to, at a national level, tidy up the bits and pieces, dot the I's and cross the T's in order to actually allow rollout under those circumstances. We would have done it exactly the same way. And we would have been first, likely, across Europe as well. Why? Because the MHRA is really, really good. And this was why it was such a shame to lose the European Medicines Agency through Brexit. I mean, we used to have on our soil in London the European Medicines Agency in tandem with our own national regulator, the MHRA. So one being the engine of the other, the two synapsing closely. And so we weren't just being the regulator for our own islands, which is what we are now because we've broken that away to make a smaller market. We were actually the regulator for Britain and across all of the single market. the European Medicines Agency had 900 other employees, specialists in this area, working alongside the MHRA. They've now gone to Amsterdam, and with it a turnover or budget of about 322 million, I think it was, and also with it about 40,000 business visits per annum in order from all the drug companies, device makers, those that needed approval, all to London, all needing accommodation, business meetings, food, travel, transport. All of that business has now got taken away. And our MHRA, which is so good, as you have just seen, is now just running the system for the UK instead of running the whole single market, and us benefiting from that financially and benefiting from that in terms of prestige, benefiting from that in terms of excellence. So the story is not that thanks to Brexit, we've got this drug faster. We always would have, but it's thanks to Brexit that we've just got it faster on our own small island, but our excellent team are limited to just working in the UK rather than setting the whole agenda for all of the European single market. That is what we have lost. That's what we've lost.